Hi, Stephanie.
Hello.
My name is Marty. I'm a level 1 student nurse, and I'm here to watch you give an insulin.
Okay.
I just have a few questions before you go in there. Is that okay?
Mm-hmm.
I'd just like to know an SBAR report, or get an SBAR report from your patient.
Okay. So we're talking about Mr. Greg Lutz. He's 67 years old. He has no drug allergies. He is in room 621, which is right behind me. Okay. He's a full code, admitted from his doctor's office for stage 2 diabetic ulcer on his right heel. Noticed about 3 weeks ago, tried soaking in salt water at home, no relief. He had increased pain and obviously wasn't healing, so that's why he's here. He does have a history of diabetes mellitus type 1. And a past surgical history of a transurethral prostate resection 5 years ago. We are waiting for wound care to come out, so in the meantime, we are just dressing the wound. We're irrigating and doing a dry sterile dressing twice a day until wound care comes out.
Okay.
A little bit about the wound. It is 5.5 centimeters by 2.5 centimeters in diameter. It's a stage 2 pressure ulcer. It is 3 centimeters deep, extending into the dermis with moderate serosanguinous drainage. It's pink with no tunneling. And let me see here. So we're just doing that until wound care comes. He's alert and oriented times 4. He's very cooperative. His pain is 1 out of 10. He's well groomed, gait steady. His pupils are equal and reactive to light. Speech is clear. He has a low fall risk, so he needs minimum assistance. Recent vital signs, blood pressure 145/72, pulse of 80, respirations of 18, temperature 98.4. Oxygen was 95% on room air, height is 5'11", and weight is 171.5. Lungs were clear, breathing unlabored, and he doesn't use any of his accessory muscles.
Okay.
Heart sounds were good. S1 and S2 were appreciated. No murmur, rub, or gallop. Regular rate and rhythm, and no carotid verwace. Capillary refill less than 3 seconds. He does have a peripheral IV in the right median vein. It's a 20 gauge. It's clean, intact, no swelling or redness. And let me see here. His abdomen is flat, symmetrical. Actually, and one more thing about the IV. There is 5 milliliters of normal saline on heparin lock.
Okay.
His abdomen is flat, symmetrical, soft, no tenderness, bowel sounds are present in all 4 quadrants, no bruise or ascites. He is on an 1,800 calorie diet, which he's been on. He did kind of stray away from it 9 months ago, so we're trying to get him back on track.
Okay.
He also has a 2-gram sodium restriction. He's going to the bathroom by himself. He had a urine output of 320 mLs. It was clear and yellow, and that was at 1550. His blood sugars have been running high for the past 5 days in the 300s. His fasting glucose on his labs was 310. A little bit more labs he had done. His albumin was 4.2, red blood cells of 4.5. His sodium was 141, chloride of 104, potassium of 3.8. His creatinine was 1.0, and his bun was 19. Hemoglobin 14.5, and hematocrit 41.2. White blood cells were 5,000, and platelets were 172,000. Bilirubin was 9.7, and his ALT was 38. His AST is still pending. And his calcium was 7.4, and his A1C on his labs was 6.5%.
Okay.
So his recent AccuCheck was done at 2030. It was 242, which is a little better because it was 290 on admission. So we're going to give him his NPH, which is a intermediate acting insulin. And we're going to give 20 units.
Okay.
Actually, I'm sorry, he does have some medications. Simvastatin 20 milligrams at night at bedtime, gabapentin 600 milligrams 3 times a day, NPH, which is what we're going to give, it's 50-50 and it's 20 units sub-Q twice a day. Then he also has regular insulin, which is sub-Q via sliding scale.
Okay. Is that it about your patient?
Yes, I believe so.
Okay, and I have a few more questions.
Sure.
So why specifically is this client receiving this medication?
He's a type 1 diabetic, so he's not able to synthesize insulin, so we're going to replace it, obviously, by giving insulin.
Okay, and what action does the medication have on the body?
Pretty much it's going to uptake synthesization in the muscle, skeletal muscle and fat, It's going to stimulate glucose uptake and inhibit hepatic glucose production.
Okay. And when should you question administering this medication?
I would question it if the patient was in severe pain, had vital signs out of range, or were very hypoglycemic.
And does the medication have a therapeutic serum level?
Yes. So you would check the labs. Like I said, fasting, his glucose was 310, which is high. We normally want to see it between 80 and 100.
Okay. Which vital signs must be monitored?
Definitely want to do just our regular vital signs: blood pressure, heart rate, respirations, oxygen, and definitely pain. And then also we could just monitor his capillary blood glucose.
Okay, and which physiological parameters should be monitored when the medication is being administered?
You want to look out for signs of hypoglycemia because we're giving insulin. It will drop his blood sugar. So signs and symptoms of that would be like nausea, restlessness, irritability, and cool to touch.
Okay. And then what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Well, I would definitely teach the client to know what medication he is on so he can verify it as well as the nurse when he is getting the medication and that it's correct. I would make sure he knows that the nurse should wash their hands, wear gloves, and dispose of the sharps in the sharps container.
Okay. And what interventions must be taught for taking the medication safely at home?
Definitely, again, educate the patient on the medication. Let him know that it's fast-acting, intermediate-acting, or long-acting insulin. Let him know what he's going to be giving. Definitely make sure he takes his capillary blood glucose. And if it's fast-acting, he has a meal in front of him, or he plans on eating within the next 15 minutes or so.
Okay.
And make sure that you educate him on rotating sites and that he can use his upper arm, abdomen, or thigh as an injection point. And make sure that he disposes of any sharps in the sharps container. Let him know about when to discard the insulin, if it looks off, if it's damaged or clumping, and things like that.
Okay. What are the side effects and potential adverse reactions?
Hypoglycemia is going to be number one, so we're going to look out for that. Also, there would be pruritus, erythema, lipodystrophy. If he injects in the same site all the time, the little fatty pockets will accumulate, and at the worst case scenario, anaphylaxis.
And how will you know the medication is effective?
By rechecking his blood glucose.
Okay. I think that's all my questions for now.
Okay, so we're going to go into Mr. Lett's room and give him his medication.
Okay.
What interventions must be taught? Are you aware of some of the signs of hypoglycemia? Well, we're going to administer
Hi.
Hi, Mr. Lutz. How are you?
Good. How are you?
Good. I'm Stephanie. I'm going to be your nurse today, and I just want to give you your insulin. Give me 1 second because my computer is dying. I just want to look at it. Sure.
Sweaty, irritability, you feel like you're aggravated,
but we want to instruct him on proper
dysphagia, medication.
All right. So it looks like we're going to get our NPH. We're going to get 20 units. Do you have any questions about that medication? Are you pretty familiar with it?
Yes.
All right. Well, I did bring a brochure, and I do actually want to give that to you. And if you have any questions later, I'll come by and we can answer any of that for you. But just a little bit about it. As an intermediate acting insulin, its peak is within 1 to 3 hours. So it says to use 30 to 60 minutes before a meal.
Okay.
And with NPH, because it is a mixed insulin, you do want to rotate it before administering it. And just check it, make sure it doesn't look funky or anything.
Here's some things to know about diabetes in
Do you need any side effects of this medication?
I think being
but you are insulin dependent, and so we want to give you some different things to know about diabetes.
cool to touch. My blood sugar would be low.
1800.
Well, you're talking about hypoglycemia. I'm talking about side effects of the NPH.
I'm not sure. Can you just tell me?
Sure. So 3 side effects we normally want you to know: drowsiness, dizziness, and lightheadedness.
Okay.
If you drink alcohol, it will worsen these symptoms. So if you drink alcohol on a regular basis, just make sure you talk to your doctor. Just go through the brochure. If you have any questions, let me know. I also gave you the 1,800 calorie brochure. So I know that you kind of of strayed away from
Why
that
is it
diet, and we
worse
want to
than
get you back on track.
All right.
So just review that, and again, if you have any questions, let me know.
Okay.
All right. So I'm going to go ahead and get your medication out. I just want to verify you are my right patient. Can you just tell me your name and age?
My name is Greg Lutz, and I'm 67 years old.
And I also want to ask you, have any drug allergies? Any sensitivity to
So
latex?
I know I was
Because do
reading
have
through your
latex
chart.
gloves.
I noticed that
Okay,
you've been
thank you.
diabetic for the last 20 years. I know this medicine isn't new to you. You've been on it for a while. Can you tell me a little bit about the medicine?
Right, sure. I'm going to put my
fast
pharm, I'm going to put my NPH.
Candies and snack with me. And
Perfect.
then I always check my blood levels regularly.
All right. And then I'm
Sure.
gonna
Do you
compare it
know
to
the
my pharm.
signs and symptoms of hypoglycemia?
Yes, usually when I run low in
I have the right patient, Mr. Greg Lutz. I have the right medication.
Well, I do have a tray here for you, so I'm going to leave that. It's important that you
pH
eat it as
50.
soon as
And I
possible.
get 20
I also have some
subcu.
additional information on the medication for you,
Expiration's
so you're
good.
welcome to
Expires
review that when I come back
2019.
around. If you have any questions, let me
Pretty
know.
good. It's a little cloudy,
Also,
but
when I was
that's
reading through your
normal.
chart, I
No
noticed that
pumping.
you've been having some troubles with your diabetic diet lately, and
Right.
remaining consistent.
And I'm gonna
with
do it
that.
the right
So I have
route,
some
which is
information on
subcu.
that for you to review as well.
All right.
It's important that you try and
I'm
follow
gonna go
the
ahead and just
best
scan your
possible
badge, and you tell me your
keep
name and
body
age.
functioning optimally, okay? So I'll
Greg
leave that
Lutz,
with you.
67
I
years old.
know.
Perfect. All right.
All right,
Scan your
so
meds
before
well.
we administer any medication, we always want to check our work five, right? So we want to make sure we have the right medication, the right
20
dose,
units.
the right medication, the right
Wash your
time,
hands.
and the right route. So, and we'll scan
Hey,
all
I'm
that.
trying
in.
to
Do you have any allergies, Mr. Light?
No.
No? Okay. And you have your meal. So let me get into your chart.
All right, and while I'm getting this ready, I just wanted to ask you, can you give me 3 symptoms of hypoglycemia?
Oh, there we go. Okay, so your blood glucose goes down. Think nausea and maybe like my heart rate increases, right?
Yep.
Are there any
You have one more for me?
So I'm going to check the medication that I have. I'm going to check it with the
No,
water to make
refill
sure
in.
it's the right
Sure, you might just
medication.
feel a little
Doctor
shaky.
hasn't ordered
Oh, that's
subcu,
right,
so I
shaky.
have my,
Okay.
subcu needle.
And
he's
let
ordering
me ask you,
6
at home,
units.
do you normally rotate sites with your insulin?
So one more time. Your
I
name is
try to.
Where do you normally give
Oh,
it?
you know what?
My
It's
abdomen.
right.
It's the easiest for me.
1 inch away from the belly button, right?
Yes.
Okay.
There we go. Now, Tiffany, I was in earlier and I had some trouble with scanning the barcode. It's just not wanting to work today. So I checked with the nurse manager. It's always okay if you can't get it to scan. You can manually enter all the numbers on the barcode. So that's what I'm going to do now.
You have the right patient, the right medication, right dose, right route, and it's the right time because he's due for this.
Okay.
All right. And then go ahead. And do you have a preference where we give the medication?
You can just still do it on my abdomen. Maybe on the right side.
Where did you have it last?
The left.
Okay.
The left side of my abdomen.
Good. So yes, we would do it on the right. Okay.
All right.
So we're gonna go ahead and give this.
I'm just waiting for the computer now.
Oh, this picture right here? Yeah.
Right. And bevels up. Gonna go at a 90-degree angle.
Hi, yes.
All right. All done. You okay?
Yeah.
Perfect. The
Oh,
patient
okay.
tolerated that. Before I go, I just want to let you know I did put some videos on your TV, and it's going to instruct you about signs and symptoms of hyper and hypoglycemia.
Okay.
You do have those handouts as well, so if you have any questions, let me know.
Cool.
So I'm going to turn these on really quick.
Mr. Kind is a 67.
And again, here's your call light, and you know how to reach us, okay?
Okay.
And
All right.
with his wife is
Okay, so I scanned them in. I did my 2 patient doses. Right medication. I'm going to check it for the color, clarity, so there's no particles.
Well, that was cool.
Medication, the
Thanks for letting me watch it.
No problem.
But I still have a few questions. Is that okay?
Of course.
Okay. So were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes. So definitely want to review and make sure that you have that capillary blood glucose in the chart before administering the insulin, just so
Okay.
you can make sure you're giving the right, just in case it was sliding scale, you're giving the right dose of insulin.
All right. And did this information affect your decision to administer the medication?
Yes, because if he was too low, then I would call the doctor and see about either holding the medication or what we would do at that point.
Okay. And last thing, did this information affect how you administered the medication?
Yes, because in the chart it's going to tell you how much to give and which route to give.
Okay. Well, I think that's all I have for you.
Okay, so I'm just going to go ahead and document.
All right. Thank you.
We